My name is Suneel Dhand. Hi, everyone. Good to be with you today. I grew up in England and went to school over there. My parents are from India, so I have an Indian background. I was born in London, grew up just outside the city, went to high school there, medical school, and then afterwards I came to the United States where I did my medical residency training. And I'm now an internal medicine doctor, practicing in both hospitals and in clinics. And I do a lot of work on social media and various different aspects of medicine, but my main passion is preventive medicine and wellness.
So I got emailed this by one of the students in France, and they wanted to know, oh, Dr. Dan, there you are. They wanted to know what got you interested in medicine initially, and then a follow-up question is what got you interested in social media, because you have a pretty good social media following as well.
So when I was in school, this is right outside London where I grew up. Growing up, I considered a number of different career options. And it's very important for young people to know this as well, that you will have lots of different things go through your head. And it's not always vital that you know exactly what you want to do from day one. But I knew going through high school that I wanted to do a job involving people. I wanted to interact with people. And then I became interested in healthcare in my late teenage years for a number of reasons. One is I had an experience where my uncle was unfortunately very unwell, and that got me interested in the medical field. Actually, before that, I can tell you when I was 15, I wanted to be a vet, an animal doctor, and I did my work experience in a vet hospital, decided then that I'd move on to humans. And in the UK, we have to make the decision when we're around 16, 17 as to what we want to do in university. And I was set by that age on medical school, and then sent in my applications, and the rest is history. Now, when I started medical school, I have to say the internet was brand new. There was no such thing as social media, which may have actually been a good thing looking back. Social media obviously took off after I graduated, and then I got into it slowly, but then realized it was a great medium for being able to pass on education and health messages. And obviously, I know we all use social media for a lot of fun and interacting with people, but there's some downsides to that as well. But in terms of education potential and say what we're doing today, it's amazing what the internet could do. And my social media presence grew from my desire to spread a health message.
And one of my favorite things that kind of sets you apart from the other people who do medical social media, I guess you can call it, I'm not sure if there's a term for it, but you stress diet, the importance of diet and exercise. Can you talk to the kids a little bit about the importance of that, especially in this day and age?
Exactly. Well, I realized quite quickly after I became a doctor that a lot of what I was seeing was related to lifestyle related chronic diseases. So what we have, and I know you haven't, you're all in different parts of the world, but I can tell you in Western countries, the US and the UK is fast catching up. A lot of the problems we face with regards to our health, once we get into our 40s, 50s, 60s, which I know seems an impossible time away for a lot of people listening, but trust me, it goes very fast. And once people get to that age, their habits in life catch up with them. And what I was noticing as a doctor was that a lot of the conditions I was dealing with, like heart disease, diabetes, lung disease, were directly related to poor lifestyle choices. And it also relates to something I wish I had done better myself when I was your age. I can say when I was a teenager, I was always quite into sports, but I was never as good with diet and exercise as I could have been. And then it fell off when I was in medical school and university, and then for a couple of years afterwards. And then I really got back into it. And I realize now that had I focused more on trying to eat a healthier diet, on exercising regularly, on dealing with stress, sleeping well, it really would have helped me. I could have achieved even more had I done those things at an earlier age.
Absolutely. And can you talk to the kids a little bit, because your perspective, I mean, in like medical history timelines, this must be like a really, fast pace time that you're in, especially with COVID, being a medical health professional. How have things been for you professionally?
Well, professionally, the last year has changed my practice a lot. I work in both hospitals and clinics, but over the last year, I've been called in much more to work in hospitals. And I've worked in a few different hospitals in the northeast of the US, and I've probably treated hundreds of COVID patients. And we had two main peaks. One was in March, April of last year, and then November, December last year. We saw surges of COVID patients come in, and I was working on COVID floors. Having to learn a lot about a new disease that we hadn't even heard of a year or two earlier. Knock on wood now, things are a little bit better with COVID, but I know from the perspective of the world stopping, and a lot of you listening now are still in lockdown and suffering the effects of the actions we've had to take because of COVID. It's been a very, very difficult time all around.
Yeah, absolutely. One of our students here, she has a question. Her microphone's not working, but she wants to know, I'm interested in becoming a doctor as well. What kind of advice would you have for me in high school as far as should I study anything in particular?
Great question. So I, firstly, congratulations on wanting to become a doctor. I would say becoming a doctor or any field in healthcare is one of the most rewarding careers you can go into. And nowadays, especially online, you'll see a lot of negativity out there from many people. But remember, those voices are always the loudest. I can vouch for doctors. I can tell you most doctors are very happy with their career choices, but you may not hear about that all the time. And if you want to go into any medical field, whether it's a doctor or anything else, I would advise you in high school, obviously from a pure study perspective, you have to excel in the sciences. That's core. That's the core knowledge base of becoming a doctor. But I would say the other thing, which is so important that I actually think I could have done better when I was around 16, 17, is work on your people skills, work on your communication skills, because actually most of being a doctor is dealing with people. In addition to the knowledge base. So whatever you can do to increase your confidence, walk into nursing homes and start talking to people, go and shadow doctors on the floor, work with nurses, whatever you can do to just simply talk to patients, that will set you ahead for when the time comes to apply to medical school, in addition to getting the grades that you need.
That's wonderful advice. And we'll ask a few more questions of you, and then we'll let you go. We can't imagine how busy you are.
Oh, right, that's now. Okay. I'm open for questions. I have a few minutes.
So one of the kids, they want to know, where do you see technology's influence in regards to the future of medicine?
Wow. The kids on here are very smart. That's a great
a lot question. Of smart kids here. So yeah. Again, feel free to text, send these questions in the chat, guys.
Yeah, technology and healthcare has changed immensely, even in the last few years that I've been in practice. And especially since COVID, we've seen, for instance, more telemedicine. A lot of consultations are happening like this, where a doctor will talk to you virtually. Working with technology, I can tell you, when I first started, we would see a patient and we would write a quick note on a piece of paper. And now pretty much everywhere in the US, it's all done on computer. So that has changed. And there's a lot of good things that have come with that. We can check out the patient's blood tests from a year or two ago. We can access medical records really quickly compared to where we were before. And I would say that the influence of technology is only going to increase, especially with certain medical treatments that are being administered. But still, I'd advise anyone who's getting into healthcare to never forget, as well as obviously the screen time we spend, it's still a very human profession. The people we're dealing with still very much value people sitting down with them, talking face to face. Obviously, we're wearing masks now, but eye to eye, and we're all about the human connection in healthcare. So never forget that. As much as technology is coming into it, we're still all about human communication on a personal level.
So this actually from me, I know there's a couple questions from the students, but I was kind of curious, out of all the things you've ever done, because I don't know if you guys know this, not only is he a doctor, is he kind of a social media personality, Dr. Dan is also a published author. Out of all the things that you've done, what are you most proud of?
I am most proud, aside from just, I would say being a doctor is always just very rewarding on a one-to-one level when you see a patient through their illness and you get them better. That's a really, really personally rewarding feeling. But on the level of especially my social media work, I would say when I'm putting messages out there and I get emails and I get messages from people all over the world who say that my pieces of advice really help them, that's extremely rewarding to me, to know that I've done that and been able to help somebody far away.
That is awesome. And you certainly are helping us today. A lot of kids kind of figuring out what they want to do. And here is a question from Emma, and I'm going to unmute Emma. She's in Italy. She had a pretty awesome question. Go ahead.
Hello. So
Hi, Emma.
hello. I wanted to be a midwife for a while now, but recently I've been interested in surgeries too. So, is there any advice that you would give me, like making a choice for my future? Like, is there anything that is, I don't know, any advice that you could give me in making a choice, I guess?
Yeah, well done on knowing what field you want to be in. Have you had any experience in that field? Have you worked with midwives or shadowed them?
No, no, no. I'm actually 16, so I'm kind of young to do anything like that in
Oh, they
Italy.
okay.
Yeah.
Sure. Yeah, maybe in
Uh,
a years you can
yeah,
shadow
yeah,
doctors. I mean, they're very different careers.
yeah.
Being a surgeon, say an obstetrician gynecologist, and being a midwife. I would say that if you're inclined towards surgery, you would be, and I'm assuming you go straight from high school to medical school, then becoming a doctor would be the main way you can do that. In the United States, we do have a career called nurse practitioners, who are kind of midway between doctors and other professionals. But I would say if you're at all inclined to do surgery, you want to in life think, what would you regret the most? I mean, you could always start off that route and then go into another. But if you become a midwife first and commit to that, and then decide later that you would wish to have done surgery, and you kind of think that for the rest of your life, that would be a bigger regret. So I would say whatever career you want, whichever one in your mind requires the most study and most dedication, is go for that. And obviously work with the professionals as well, so that you get experience.
It's pretty solid advice, and you heard it from him first. And you guys check out his social media channels and social media pages. And before I get on to a few more questions, where can they find you if they don't already follow you on social media?
Sure. So you can Google my name, Suneel Dhand, which Ralph can give you afterwards. And I have a main website. And from there, there's links to me on YouTube, on Facebook, and Instagram. All of those are my main channels, and LinkedIn as well. But probably most of you are not on LinkedIn. It's more for professionals who have graduated. So I would say Facebook, Instagram, and YouTube channel would be the main ways.
That's great. That's great. We have a couple more questions, and then, like I said, we'll let you go. We have Giorgio, and he is also in Italy. A lot of these kids are in Italy today. Giorgio, you should be able to ask.
Hello. So first of all,
Hi,
it's
Giorgio.
nice to meet you. Hi. So first of all, it's nice to meet you. And my question was, is it difficult to connect with a patient that has like a drastic different age with respect to your age? Like perhaps he is very old or very young.
Oh, yeah, sure. No, I would say that you have to adapt. And this is something you learn when you're in the medical field. You adapt the way you talk to people. So when I'm with, say, a very young patient who's 19 or 20, I'll talk on a different level to someone who's 85 or 90. I would say the number one thing for most people is to perceive that they are with someone who's firstly competent and also someone who cares. If you can show that you care about your patient, no matter what their age, they will be happy with you. They will want you to be their doctor. And with time, you sort of learn these different communication methods. So that's a great question. But no, that's something that does come with experience.
Good advice. Great question. We have the last student question. This is Michael, and he's in Italy as well. Michael, go ahead and ask.
Hi, nice to meet you.
You too, Michael.
In future, I would like to become a doctor, but for now, I'm still thinking if it will be a good choice. Because I also like other subjects in school, like physics and things like these, usually scientific subjects. So my question is, how can I know if becoming a doctor is the right choice? Like you have some advice to give me?
Yeah, so I mean, it sounds like you know what your interests are, which is a good thing. And again, I can't stress enough, it's not a problem to not know exactly what you want. And sometimes it's a good thing to know what you don't want to do. That's also the case. So you said what you want to do, and sometimes when you narrow down your choices, it's good to say, like, I knew, for instance, I don't want to do a job where I sit down at a desk all day. So many things like finance, accounting, computers were ruled out by that. I wanted to deal with people. And I would say to you, similar to what I said earlier, the best way is to try to get some experience shadowing professionals when you're in the, whether you're in a hospital or clinic, so that you just understand. I remember in England anyway, I was 16 when I started doing that. And remember that medicine is such a wide field that you could find something to suit almost any personality. So you say you like science and physics, you could do something like radiation oncology or radiology, where there's more of that involved. And then if you like working with your hands, you could do surgery. If you like working with people, then you could be more like a regular outpatient general practitioner. That's why there's so many choices within the medical field if you want to do it according to what you like. Like, I know people that don't particularly like talking to patients, and they become radiologists or anesthesiologists. There's lots of different ways you can go within medicine if you know you're drawn to that field.
There's jobs for the introvert and jobs for the extrovert. That's what it sounds like. So we had one more student question, if that's okay, and then we'll let you go. This is Julia. Julia, you had a great question. Go ahead and ask.
Hi, first of all, thank you so much for being here. I'd like to ask you, how do you handle the pressure of being going through med school and also your everyday job? Like, you have the patient's health in your hands, and you make a lot of decisions, I think.
Yeah, absolutely. And that's something that no doctor takes lightly. And I would say that is also something that comes with experience. And the good thing is, especially in Western medical systems, and I'm sure Italy is the same, is they won't let you graduate as a doctor unless you've passed all of the skills tests and you've reached a certain level of competency. And what you have to remember is, when you first become a doctor, you enter a new phase of training. You start off as a junior doctor, so you're always working with senior doctors. And I remember well, when I was going through that, any decision at all, I would coordinate with my senior doctors, and you progress that way. So while it may seem very daunting at first, especially before you've even started school, thinking, well, how could I do that? You're sort of eased into that role, and you won't reach the point where you're the main decision maker until you're ready for it. So don't worry about that. It's a gradual progression with increasing decisions along the way.
Dr. Dan, we can't thank you enough for spending 20 minutes with us today to talk to us about your career and the medical profession and giving these young kids advice. I'm going to end the meeting for all in a second, but before I do, I'm going to allow everyone to unmute themselves. And can we all say thank you to Dr. Dan for taking time out of his very busy schedule to speak to you guys today?
Thank you very much.
Thank you.
Thank you.
Thank you.
Appreciate it.
My pleasure, and good luck
Thank
to
you.
everyone. And can I say, it may seem like a long way away, but I want you to remember that Dr. Dan told you today, May the 4th, 2021, whatever it is you want to do, the time goes really fast, and you will be qualified in whatever field you want to do before you even know it. And it's really important to have goals in mind, to work really, really hard. And that doesn't mean not having a personal life. I'm all about, you work hard and then you can enjoy yourself, whether that's playing sports or anything else. You have to have a balanced life. But right now, especially when you're in school, studies have to be number one, because it will pay off later more than you could ever imagine.